So, the posterior wall and the anterior wall of the middle ear cavity, one more modification of the anterior wall. When we see this anterior wall, this is the canal for the tensor tympani muscle, and this is the opening of the auditory tube. Between these two openings, the opening of the canal for tensor tympani and the opening of the auditory tube, a bony projection between these two, is running backward, and this bony projection provides the site for the turn of the tensor tympani muscle. So, running tensor tympani is taking a sharp turn against this bony prominence, and this bony prominence is known as processus cochleariformis. This is known as processus cochleariformis. This processus cochleariformis, it is a bony projection which is separating the canal for the tensor tympani and the opening of the auditory tube, and upper part, the roof here is formed by the tegment tympani. So, this is the tegment tympani. So, roof is formed by tegment tympani. Tegment tympani is a thin plate which is running backward to form or roofing the canal for the tensor tympani, below the canal and above the auditory tube or the eustachian tube. There is an elevation or sharp bony projection known as processus cochleariformis, which provides the projection for taking turn of the tensor tympani, which is ultimately inserted in the handle of the malleus and makes the pull on the tympanic membrane, which form the compact part or the pars compacta of the tympanic membrane. Now, we have seen the roof, the floor, the posterior wall and the anterior wall. Again I will repeat, this roof or the superior wall is known as tegmental surface. This posterior is known as the mastoid wall. The floor which is related to the superior bulb of the jugular vein. So, this is the jugular wall, and this anterior, although it is related to the canal for tensor tympani, the eustachian tube or pharyngotympanic tube, and the lowermost part is related to this internal carotid artery, but this is known as the carotid wall, or sometimes also known as the eustachian wall. The medial wall, little complicated wall. The medial wall is having multiple modifications. The medial wall Again, this is the mastoid process. This thin plate is the tegmen tympani, the roof of the middle ear cavity. This is the adytus, and this is the mastoid antrum, and these are the mastoid air cells. So, this is a thin plate. These are mastoid air cells, and here we can see a round elevation. Which is produced by the first turn of the cochlea. What are the turns of the cochlea? Which is having 2 and 3/4 turns. I will talk in detail in my next lecture. So, this is the internal carotid artery, which is having a tangle of the nerves around it, the network of the nerves. This network is formed by the postganglionic sympathetic fibers from the cervical ganglia. So, this is the internal carotid artery. And this is the internal jugular vein. This is the jugular vein. This is the tympanic nerve, branch of the glossopharyngeal nerve. This nerve is entering in the middle ear cavity and indenting the lateral surface of the promontory. So, this is the tympanic nerve conveying the somatic afferent modalities to the brainstem through the glossopharyngeal nerve. So, this is the tympanic nerve. Don't get confused this nerve by carotico-tympanic nerves. The superior and the inferior carotico-tympanic nerves are postganglionic sympathetic nerves which are innervating the mucosa, vasomotor for the mucosa. So, this is the tympanic branch of the glossopharyngeal nerve, and this is forming plexus, the tympanic plexus in the middle ear cavity and innervating general somatic afferent fibers to the middle ear cavity. So, there is a tympanic canaliculus which accommodates the tympanic branch of the glossopharyngeal nerve. Sorry. This is the processus cochleariformis. This is the processus cochleariformis, which is separating the canal for the tensor tympani muscle and the auditory canal, and also providing the site for the winding of the tensor tympani muscle to be inserted on the handle and neck part of the malleus ossicle. This beautiful curved structure forming the component of the medial wall, running backward, entering in the posterior wall and descending downwards through the mastoid part of the bone and leaving the skull through an opening. This opening is known as stylomastoid foramen. So, this is the stylomastoid foramen, and you all know, if you are medical student or a practicing doctor or neurologist, you are well versed with the anatomy of the structure. Yeah, this is fascial nerve. There are two openings. One is on the posterior superior part of the promontory, one is on the posterior inferior part of the promontory. As we all know, beneath this middle ear cavity or deeper to this middle ear cavity, there is internal ear, which is also having different parts like the cochlea, the vestibule and these semicircular canals. This oval opening produced by vestibule and open in vestibule, this is known as fenestra vestibuli. This is oval opening, so this is also known as oval window. This oval window is closed by the foot plate of the stapes muscle. So, stapes muscle is closing this fenestra vestibuli or the oval window. The step is small bone like this. It is having body, neck and anterior and posterior processes, and this foot plate This oval shaped foot plate is closing this fenestra vestibuli or the oval window, which leads to in the vestibular parts of the internal ear. The lowermost part or posterior inferior part of the promontory is having a round opening. So, this is known as fenestra cochleae. Or also known as the round window. So, this is having the oval window and this is the oval window and this is the round window. The fenestra cochleae is round window and fenestra vestibuli is oval window. This opening, the fenestra cochleae opens in the sinus tympani or scala tympani. This is not sinus, this is scala tympani. The last part of the cochlear turn is divided by bony projection in upper part and lower part. The upper part above the spiral laminae is the scala vestibuli and lower part or below the spiral lamina is the scala tympani. So, this opens in the scala tympani and it is closed by secondary tympanic membrane. So, this is the secondary tympanic membrane. So, what can we see here? Again, we will see this part. This part is having the oval window known as fenestra vestibuli and closed by foot plate of the stapes. The scala tympani or the round window which is closed by the secondary tympanic membrane. Now, we can see one more elevation or opening. This is the pyramid. As I have already stated, the upper part of this is having the stapedius muscle and lower part of this pyramid remains continue with the canal for the facial nerve. So, it is at the junction of the posterior and medial wall of the middle ear cavity and its upper part is accommodating the stapedius muscle and lower part remains continue with the canal for the facial nerve. We can see small depression here. This small depression is known as sinus tympani. This is depression, so this is sinus tympani, and this sinus tympani is the depression of the ampulla of the posterior semicircular canal. There are three semicircular canals in the posterior most part of the labyrinthine, and all three canals are situated or orientated. The orientation of these three canals are at right angle to each other, like one is this, the other is this, and third one is also at right angle to both. So, orientation is at right angle. So, ampulla, each canal is having a circular part and one dilated end. The dilated part is known as the ampulla. So, this sinus tympani is produced by the ampulla of the posterior semicircular canal. one more elevation above the canal for the facial nerve, and this is produced by the posteriormost part of the semicircular canals. So, in the medial wall, we can see the promontory which is grooved by the tympanic branch of the glossopharyngeal nerve. The facial nerve running downward, backward, and leaving the skull through the stylomastoid foramen. The fenestra vestibuli, which is also known as oval window, and the fenestra cochleae, which is the round window and closed by the secondary tympanic membrane. The pyramid and the sinus tympani. So, these are the modifications of the medial wall. Now, I will talk about the lateral wall or membranous wall, which is formed by the medial surface of the tympanic membrane, and uppermost part is formed by the squamous temporal bone, which is known as the epitympanic recess or epitympanic part of the middle ear cavity. So, the lateral wall is formed by the tympanic membrane and the, so again this is the tegment tympani and this is the tympanic membrane, the malleus, the handle, this is part is the umbo. This is the tensor tympani muscle. And this is the chorda tympani nerve, which is running from posterior to anterior part, entering from the posterior canaliculi and leaving the middle ear cavity through the anterior canaliculi. And this is again the processus cochleariformis, separating the canal for the tensor tympani and the Eustachian canal. And this muscle, the tensor tympani, is taking a sharp turn on the anteriormost part of this processus cochleariformis and inserted on the handle of the malleus. This makes a pull on the tympanic membrane, which will make this part of the membrane tense, known as pars compactensa or pars compacta, and this is pars flaccida part. So, this canaliculus is in the posterior wall, the anterior canaliculus is situated in the anteriormost part of the tympanic membrane or anteriormost part of the medial wall. One more modification in anterior part is the petrotympanic recess or petrotympanic fissure. The petrotympanic fissure. This fissure will accommodate the anterior ligament of the malleus and also accommodate the tympanic branch of the maxillary artery. This is the tympanic branch of the maxillary artery. This is the tensor tympani, and this is the again the processes cochleariformis, and this is the tympanic membrane. So this part is forming the lateral wall of the tympanic cavity, and this is forming the part of the epitympanic recess or the epitympanum. So we have seen the medial wall, which is formed by multiple modifications like promontory, round window, oval window, pyramid and sinus tympani, and we have seen the lateral wall, which is formed by the convex tympanic membrane and part of the squamous temporal bone. In next lecture, I will talk about the mastoid process and ear ossicles.